Good afternoon, and thank you for joining One Group's informational update. My name is Allison Dunn. We are glad you could join us for our seventh update on the coronavirus and various business-related impacts. There's a lot of information out there, and we certainly appreciate you spending your time with us. Currently, we know that businesses are working on their plans for their employees returning to work, and those essential businesses where employees have been reporting into work are working on creating plans to renew their efforts to ensure safety in the workplace. We also know there's quite a bit going on in Congress with the proposed $3 trillion HEROES Act. We'll cover some highlights of that today, as well as several timely updates to help you as you navigate in this unprecedented environment. We have several of our experts with us today. We have Kelly Goodsell, who is our Vice President of Claims Risk Management, Dennis Ast, Senior Account Executive and Cyber Risk Specialist, Casey Cohn, Senior Human Resources Consultant, Nate Bradley, Employee Benefits Consultant, Joe Hatfield, Vice President of One Group Retirement Advisors, and last but certainly not least, we have Todd Hoffman, our Senior Bank Liaison. We will be discussing updates to address our clients' frequently asked questions in the areas of claims and risk management, including cyber, also human resources, employee benefits, including retirement plans, and we will touch on the Paycheck Protection Program. So lots to cover. We do have to include our disclaimer that this is for informational and educational use only, and nothing in this discussion should be considered legal advice. Please consult with the appropriate attorney or advisor before addressing any situation raised in our discussion today. And for today, we've structured the discussion to cover key updates and areas that our clients have been asking us about. We also requested that participants share any questions with us beforehand. And certainly due to the number of participants on the call, we've muted all callers. If you do have questions after the discussion, please reach out to us. Reach out to your One Group contact. We will, as we have been doing, we will continue to post content to our website, onegroup.com. We have a whole section dedicated to COVID-19, and that will include this webinar from today, taped webinar, all references we make to different documents, as well as many other helpful tools. So with that, we'll turn the conversation to claims and risk management and Kelly Goodsell. And Kelly has been working extensively with our clients on various claims-related matters, many of which are very challenging. Kelly?
Thanks, Allison. Good afternoon, everybody. For those of you that have been with us all along, I think we're on week 8 or week 9 here. You'll have to forgive me. I've personally lost track. I'll just give a quick recap with respect to property and casualty insurance and specifically business interruption, extra expense, and civil authority. As most of you know by this time that the majority of the policies exclude viruses, and therefore they do not provide coverage for business interruption. The insurance contract does not feel that, it doesn't specify that a virus is actually a covered cause of loss, so therefore the coverage is not extended. So with all that being said, there are 8 states currently that have proposed legislation and bills within those states actually requesting that the insurance carriers retroactively change their contractual language in the policy and provide BI and extra expense coverage to businesses. Some of them are defined as small businesses with under 100 employees, and some of them are defined under 250 employees. So nothing has been passed to date. I thought we were going to get really close at the federal level last week, about 10 days ago, but again, it was tabled. So with that being said, we just continue to really monitor what's going on at the state and the federal level relative to the business interruption coverage. A couple of other things that have been going on with respect to claims is we're seeing quite a bit of a delay in the workers' compensation world relative to treatment, as you know, some of the physicians and the physical therapists or the pain management treatment centers they have not been able to see workers' compensation employees. I'm hopeful, at least in this area, that they will start to open up and they'll start to be able to get the treatment that they need. But with that being said, we're seeing some questions that people may be getting close to the end of their workers' compensation and their doctor may be talking with them about returning to work. And now we're getting a lot of questions from, the injured worker, do I have to return to work? And when they're saying that, it's more relative to COVID-19 and do I have to return to work? So it's a legitimate question, and I would encourage you that if you do get any of those questions, do what I do and go right to my HR consultants, Allison and Casey and Nate. A few of them are on the phone with us today, and they'll be able to help you out if you want those types of questions. Another question that I've been seeing in the last couple of weeks from the employer's perspective is, as now we're starting to transition and plan on bringing our employees back into the workplace, from the employer's perspective, am I liable? Am I liable if somebody comes back to work and they get COVID-19? There's a lot of if, and, or buts there, but if my recommendation to all of our clients, and I know Paul and Allison have covered this in previous webinars, is, the procedures and the proper documentation. So the best defense to any claim or lawsuit is documentation, documenting what your efforts have been in safety, in the PPE area, and all of the things that you have done to ensure that your employees are returning back to a safe workplace. Also starting to see some employment practices claims relative to discrimination in the workplace. I'm an essential worker, but I don't want to come back because I'm fearful of COVID-19. And we're starting to see some resignations in that area as well. So again, documentation is always key to defending yourself in any type of claim or legal employment matter. I really think from a claims perspective, Allison, that's kind of what's been going on in the last week to 10 days.
Perfect. Thank you, Kelly. It's great to get that real-time information and your insight. So thank you. We're going to turn things over to Dennis Ast. Dennis will provide us with some information, some important reminders on cyber best practices. Dennis?
Yeah, thanks, Allison. Good afternoon, everybody. Just a couple of updates from what we're kind of seeing out, in kind of the cyber world and where we're seeing cyber attacks currently. So yesterday I saw a report from CNN that both DHS and the FBI have issued a warning that China is likely launching cyber attacks to steal coronavirus treatment and vaccine information and research. So they've forewarned research facilities and hospitals to be on the lookout for attacks. We've seen an increase in phishing again, mostly, coming from what appears to be either the World Health Organization or the United Nations, and suggesting donations to a COVID-19 fund that's fraudulent. And also over the last 3 weeks, we've seen about 20,000 new domains being registered relative to something relative to Corona, with the most popular one being Corona Cure. So the cyber criminals continue to be at it and trying to look for avenues to increase their revenue stream and to take advantage of people's, fears and concerns. So how do we combat this? We'll talk about some good cyber hygiene practices. So the main one is employee training. That's always your start. We don't want employees clicking on the wrong attachments, the wrong emails. They need to look out for those particular type of emails that could be malicious on both their personal email as well as their work email, because many folks now working remotely are working on personal devices and connecting to work. So, think before you click. Does this really make sense? Should I click on this? And of course, don't panic. Just pause, think about it, before you go ahead and open it. Strongly encourage multi-factor authentication and the utilization of VPNs. There was some information out last week that Some of the hackers have gotten into the VPNs, and they're putting some patches in to take care of that. Suggest strong passwords or passphrases make it difficult for these cyber criminals to get into your system. Don't use public Wi-Fi if you can at all avoid it. There's always a higher risk when you're using public Wi-Fi. Secure your mobile devices, so as you're allowing employees to access your system remotely, make sure you have some security there. Install and update anti-malware on all of your systems, especially next-gen anti-malware that deals with artificial intelligence so that it's learning and it can identify new malware attacks that are taking place. Stay current with all of your patching and updates. Those notices you get to, update apps on your iPhone or, your computer, your laptop, your Surface. It's because there's some type of security risk that's out there that's been identified and the patch is taking care of that. So please stay current with your updates. Do a risk assessment, know what you have out there, know what type of things you have connected to your network. So if you do have a cyber attack, you're easier to assess it and to understand what the potential is. There's a great framework out there called NIST, N-I-S-T. It's free. It's very user-friendly from a small company to a large company, so I'd encourage you to look into that. Always have backups. Always test your backups. Monitor your backups to make sure they're not infected. And if you at all can, air gap them, which means totally disconnect them from the internet or being connected at all, so there's less likely that they can get affected. Have great vendor management in place. Understand what the contracts are. Make sure they're beneficial to you. Cloud providers, server providers are all going to want to not take responsibility if a breach happens, but if you simply ask them, in many cases, they will defend and indemnify you if there's a breach caused on their end. And the biggest thing I can say is have a cyber response plan. Know what you're going to do if you have that loss. Do you have an insurance policy in place? Do you know what the number is to call the claim and get a breach coach assigned? If you don't have a cyber policy in place, do you have somebody set up to be your breach coach that can help you through the process? Doing things efficiently and timely is going to be very critical when you realize that you have a breach to hopefully minimize it. So it's a very quick update. So I wish everybody a great day. Back to you, Allison.
Great, Dennis, thank you so much. Now we're going to turn to human resources updates. We have witnessed many changes in this area, and we're seeing clarifications being issued on guidance that's been released. So we have Casey Cohn with us today, and Casey and our HR consulting team have been very busy advising our clients relating to new legislation and the related questions, as well as how to administer, as well as certainly best practices. So we will now turn things over to Casey to provide us with an overview.
Thanks so much, Allison. Hi, everyone. I want to spend just a few minutes talking about some updates that the Equal Employment Opportunity Commission, EEOC, put out. We talked a few weeks ago about some of the updated guidance that the EEOC has listed, and they've continued to make some additional changes or continue to update its guidance on its website specific to how the ADA interplays during the pandemic time. So just want to talk about a few of the recent updates. One specifically with regards to disability-related inquiries and medical exams. So, and we've received a question from our clients as well, but may an employer administer a COVID-19 test attested to detect the presence of the COVID-19 virus before permitting employees to enter the workplace? The response to this is, generally an employer may choose to administer this type of testing to employees before they can enter the workplace to determine if they have the virus. The ADA requires that any mandatory medical test of employees is job-related and consistent with business necessity. So it is possible. There's some different parameters and things to consider when doing so, but overall an employer may choose to administer the testing before employees enter the workplace. Another question with regards to reasonable accommodation. Does the ADA apply to applicants and employees who are classified as critical infrastructure workers or essential critical workers as defined by the CDC? So does the ADA apply to those individuals? And the answer is yes. The CDC designations do not eliminate someone's coverage under the ADA. So therefore, if a request for an accommodation comes in and someone's an essential worker, an employer still has to treat that request as they would, whether the employee is considered an essential employee or not. They have to treat those requests the same. With regards to return to work, what does an employee need to do in order to request reasonable accommodation from their employer because they have one of the medical conditions that the CDC says may put them at a higher risk for severe illness from COVID-19? So if you have, or if an employee is in that situation where they need to request an accommodation because they have a medical condition that the CDC says could put them at higher risk if they do contract COVID, that employee needs to let the employer know that they need a change for a reason related to a medical condition. After receiving that request, the employer can then ask questions or seek medical documentation to help decide if that individual has a disability and if there is a reasonable accommodation, of course, if not an undue hardship, but that can be provided. Other questions that the EEOC provided some clarification on. The CDC identifies a number of medical conditions that might place individuals at higher risk for severe illness, similar to what I just mentioned. And if an employer knows that an employee has one of those conditions and is concerned about their health, concerned that their health will be jeopardized upon returning to work, and the employee has not requested an accommodation, what can the employer do, or how does the ADA apply in that situation? So first, if the employee does not request a reasonable accommodation, the ADA does not mandate that the employer take action. So if the employer is concerned about the employee's health being jeopardized upon returning to work, the ADA does not allow the employer to exclude that employee or take any other adverse action solely because that person has a disability that the CDC identifies as potentially placing them at a higher risk for severe illness if they get the COVID-19. So again, if someone is in that situation, they need to request or have their doctor request an accommodation with their employer, put their employer on notice, but the employer cannot take action only because they are aware that the employee has something that could put them at danger should they become exposed to COVID-19. The EEOC also updated some examples of accommodations that could be provided to employees should they need them. They include examples such as additional or enhanced protective gowns, masks, gloves. They talked about barriers, temporary modification of work schedules, moving someone's work location where they perform work, and they gave an example of someone's in the middle of a production line, move them to the end of the production line, just to provide some more social distancing. So what does this all mean? This is all available on the EEOC's website, and we'll post this, the FAQs on our website as well, so you can see those, and the EEOC is continuing to update its guidance on this. But essentially, employers just need to be aware of this guidance. They have a duty to accommodate, to maintain a safe working environment. However, it does not create this limitless right for an employer to ask an employee about their medical condition. So there's definitely certain things that an employer cannot automatically do should they be aware of something. And then one last update, something we talked about previously, but just as an awareness matter. But, as we discussed, there could be additional considerations to make with regards to employees in the way in which we all perform work as we look to kind of reopen and return to work. So to date, there could be several employers out there who may not have had to administer the FFCRA leave, so the Family First Coronavirus Response Act leaves. However, this could certainly change as we look to have employees return to the workplace. There certainly could be an increase for these leave requests, especially as we know in New York, the schools have been officially closed at the end of the year, so there certainly could be requests for leave due to someone caring for their child because their school or place of care is closed. And as a reminder, these leave provisions, the FFCRA leave provisions, are in effect at least through the end of the year, so through December 31st. So it's just important to make sure you're aware of those things and how to handle those requests should you receive any. And of course, if there's any questions, please don't hesitate to reach out to any one of your consultants. We're here and happy to help, and we'll be posting a lot of the information on our website as well. Thank you, and with that, I'll turn it back to Allison.
Thank you, Casey. Great information. Now we'll turn to Nate Bradley for an update on our employee benefits matters. It's funny because when we plan the webinars, we always think of what our content will be, and then we were amazed at all of the new content that came our way in just the past couple of days. So Nate's been working closely with our consultants and clients to ensure that any compliance-related changes are communicated, and certainly he's been watching all of the proposed changes as well. So Nate, we will turn it over to you.
Thank you, Allison. And like you said, all of a sudden there is a whole bunch of new updates that have just been kind of released to us in the last couple of days. First thing I'll touch on is just you've probably seen in the news, if you're following things like we are, the newest piece of legislation that's working its way through the House, referred to as the HEROES Act, the next $3 trillion that they're looking to spend on this whole ordeal. The main centerpiece of it is the almost $900 billion in state and local aid to governments, state governments, county governments that are really struggling during all this. And then more aid that would go directly to individuals, as well as a couple $100 billion in tax credits for employee retention. Much of the rest of what has been put into this act is considered more of a wish list. The largest benefits component included in this would be probably the expansion of the COBRA benefits, extending from March through January of next year, including fully funding private employer insurance premiums for laid off or furloughed workers between now and next January. So we're keeping an eye on that. Common criticism on this is that it's been, not a lot of items that are making its way into it have nothing to do with coronavirus relief. So there's probably very little chance that this is going to pass the Senate, who is not even really expected to consider another relief bill until after the Memorial Day recess. So they really want to kind of let the CARES Act play out, see what worked, what didn't, where more relief is needed. But we don't really anticipate this getting through, but we're keeping an eye on things. We wanted to mention it because it is out there. But for right now, the next few weeks, just hang tight on things. And like I said, we'll continue to push that information out once it is, signed into law and there's changes that you need to be made aware of. On that note, there are some FSA flexible spending account updates that were released a couple days ago. We have a blast going out to all clients later on today that contain a lot more detail than I'm going to get into, as well as links out to the notices. But one of the main things that this will do is expand mid-year elections to medical flexible spending accounts. So we had previously mentioned on these calls and let clients know that dependent care accounts could be adjusted. But as of a couple of days ago, you couldn't change your election that you had this year to a medical flexible spending account. This will allow participants to prospectively revoke an election, make a new election, or decrease or increase an election to a medical FSA or dependent care account. And this would also include limited purpose flexible spending accounts. So those of you who perhaps have high deductible plans but still have a limited purpose flexible spending account for dental and vision expenses. So previously, when school was out, now canceled, and before and after school programs were being canceled, people wanted to decrease their elections to their dependent care accounts, and that was allowed. Now, even we'll see what happens, but if summer programs start to get canceled, people may have put too much in those accounts. The aim to this now is to allow a response to anyone who may have been impacted. Let's be honest, we're all impacted by this pandemic, and money that you may have put in a medical flexible spending account. So think, you had a dental procedure that you knew was going to be expensive. You put money in that account, and now that is not, is going to be delayed until later in this year, or you may not have it at all. So you would be able to cancel your or re-elect, the amount into that account. Same thing with maybe perhaps a medical procedure that was scheduled that is now not going to take place. So this will allow you to make adjustments to the medical flexible spending accounts. I'll also say that the notice is very clear, and these are the words that they use, that this is not a free-for-all, and that the employer does have the discretion to impose parameters for these election changes, including the extent to which the election changes are permitted and applied, and they can limit the period during which election changes may be made. So you can say, we're allowing you to make a change at this time, not whenever you want to come through the door for the rest of the year to make a change, you can. So the employer does have some leeway in how they want to roll out. But again, like I mentioned, there will be a blast going out to all clients on that later today. Another part of the FSA changes, and this is probably one of the bigger parts of it other than that previous one, is with those employers that are offering a $500 rollover in their flexible spending account that has been an option for a few years now, so that it was no longer a hard use it or lose it, you could roll over $500. It has been $500 since that was put into place. This will increase it to $550 next year, and then establishes that it will now be adjusted annually for inflation. So that will be a moving amount year after year. It will not just be a flat amount. So it will allow, as the accounts, the amount in the account gets increased each year. We're at $27.50 this year. You'll be able to also roll over more of that account in the future. Doing any of this may require plan amendments, so you would probably want to speak with your TPA or your consultant to help put these changes into place for your plan. The next big piece, and bear with me here because this is kind of can be confusing, and we're going to post all of this to the website, but on April 28th, the DOL, IRS, and HHS issued guidance and relief related to COBRA and HIPAA special enrollment rights. Most notably, the guidance requires employers and plans to suspend the deadline for qualified beneficiaries to elect COBRA or pay COBRA premiums from March 1st until 60 days after the national emergency ends. So when's the national emergency going to end? It's kind of up in the air right now. In order to ease the burden on participants and beneficiaries, the DOL, in coordination with the IRS, issued a final rule extending certain timeframes and deadlines for participants to consider coverage elections and benefit decisions under ERISA and the code. So the duration of the relief, the rule provides that in determining certain plan timeframes, the duration of what they're referring to as the outbreak period is to be disregarded. So essentially just pretend this whole time period is not taking place when you're giving out COBRA notices or people are electing COBRA or paying their COBRA premiums. So the outbreak period is right now going to be considered from March 1st until 60 days after the end of the national emergency or another date announced by the DOL and Treasury in a future notice. The rule provides that to the extent there are different outbreak periods and end dates for different parts of the country, they will issue additional guidance. And the rule also notes that per the statutory provisions in the Internal Revenue Code and ERISA that provides the basis for these extensions, the period required to be disregarded may not be longer than 1 year. So there is a worst case scenario. Hopefully the date is a lot more than 1 year from March, but that would be kind of the worst case scenario. Again, this is all going to be posted, so bear with me. Dates included in the final rule that are going to be kind of on pause are as follows. First, the 30-day period to request a special enrollment. So think someone who gets married and is going to add their spouse, someone who has a baby and is going to add their new dependent, or they lose other coverage. Typically, they would have to make that election within 30 days. Now they have until the end, 60 days after the outbreak period, and then another 30 days on top of that. Also, the deadline for those individuals to notify the plan of those events. So their regular 30-day window is extended. They also have an extension on when they would have to let you know that they're going to add these the people to the plan. The 60-day election period for COBRA continuation coverage will be extended. The date or deadline for making COBRA premium payments. And then there's also some related to claims filing and appeals to claim adverse decisions, things like that in the plan. Those things are all being extended And then consistent with this, employers are also receiving relief in that they're not tied to the 14 days to send that COBRA notice. They could essentially wait until 60 days after the outbreak period. We would still suggest sending the notice out as timely as possible. The examples that I'm going to try to go through, we have the actual examples that will be posted to the website that came from the IRS. It's really up in the air what the dates are right now, but for these examples, they're using March 1st through June 29th as the outbreak period. So for the first example of someone who would be electing COBRA, someone has a COBRA qualifying event, they're eligible, they're provided their COBRA election notice on April 1st. What would their deadline be to elect COBRA? Normally their deadline would be 60 days, so around June 1st, end of May. In this situation, you have to disregard that outbreak period, and the last day of their COBRA election period is 60 days after the outbreak period of June 29th, which brings you to the end of August. So someone who gets their COBRA for April 1st will have till the end of August to elect to enroll in those COBRA benefits. If they do elect, they will have 1 to 5 months of premiums that they would have to pay to be rolled retroactively back to that date and then be current. So it may be unlikely that anyone's going to take advantage of that entire time, because 5 months of COBRA premiums would be very expensive for someone who's out of work. But this really is just kind of pressing pause on all of the dates that we would normally go by and just pretend this whole middle few months here is not happening. When it comes to COBRA premium payments, for example, you have an individual who is currently enrolled in COBRA. They paid their premiums through February, but now they're late on their March payment. Payments made for those March premiums by 30 days after June 29th, or the end of the outbreak period in this example, which would be July 29th, for March, April, May, and June would be considered timely, and the individual is entitled to COBRA for these months if they make the timely payment. Important to note that if the individual does not pay their premium timely, they can be terminated from the plan. You do not have to keep them on the plan if they are not paying their premiums. This guidance, however, would give them the right to pay all of their back premium in a timely manner according to these regulations, and then be reinstated retroactively. So employers do not have to continue to cover former employees if they're not paying their premiums. So you would follow the same grace periods that you normally would, or your COBRA administrator would do that. So you're not at risk of paying for claims for individuals that are incurring claims but are not paying their premiums. However, if they do ultimately pay their premiums, what would be considered timely, then they would get enrolled retroactively, and then those claims would be covered. The next example is just same situation, but say they only paid a couple months of premium, because they couldn't come up with 5 months of premium. They'd get covered back to March and April, but then they would be terminated after that. So there is a lot of moving parts with this COBRA, and we are still going through everything and trying to help clients as well as ourselves understand it. I'm not going to give you my personal opinion on it, but it seems to be a shared opinion by a lot of other consultants on a lot of webinars that I've been on. Last quick example is regarding to the special enrollment periods. So an individual is eligible for the plan but previously declined, and then they give birth and would like to enroll themselves and their child into the plan. Open enrollment's not to the end of the year, but this is a qualifying event for them to do so. They may exercise the special enrollment rights all the way up through the end, 30 days after the end of the outbreak period. So after July 29th, and then as long as they pay all their back premiums, they would be enrolled back to coverage. So what would normally be a 30-day window to notify the plan and enroll the child is extended through the outbreak period plus 30 days. And again, the easiest way to explain all these changes are almost to just pretend as if these months aren't happening, press pause on everything, and then picking up again with those same dates after the outbreak. So if somebody was already delinquent in their COBRA, they had 30 more days to pay. They don't get 60 days plus 30 days at the end. They only get 30 days added on. Everything that I just covered was released within the past week or a couple of days, and we're continuing to work through it all and working with our carrier partners to better understand how it can best help all of our mutual clients. I know it's a lot of information. Again, it is posted on the website. Please reach out to us if you have specific questions on your situation, and we will be able to help you work through them, and we will continue to release information as it becomes available. That's it. Thank you, Allison.
Thank you, Nate. That was a lot to cover. And I know we have our blast we'll be sending out today that will reiterate a lot of what you covered. And then you mentioned the website, which is a great source of information. So lots to cover. Thank you. We're going to turn to Joe Hatfield now. We're talking about employee benefits, so we thought we would share with you some information on retirement plans, plan sponsor information. So Joe is with us today, and he will provide us with some helpful information, I'm sure. Joe?
Perfect. Thank you, Allison, and good afternoon, everyone. I promise I have far less to cover with you comparing to Nate, so we'll dig right in. Not a lot of new information on the 401k front, thankfully. It seems like in January we were unpacking the Secure Act, and the coronavirus came, so we had to unpack and digest the CARES Act. So again, I'm welcoming a few weeks without anything substantial to deal with initiatives in the retirement plan space. So what I wanted to do is just share with you some statistics that were part of a report that T. Rowe Price published in the last few days to kind of give us all an idea of what the participants inside of our retirement plans are doing. Thankfully, in terms of activity, it's not a lot, but there are some really important things here that I think we all need to be aware of. So that as plan sponsors, you're making sure that your participants have the resources they need to be able to gather the information that they're looking for. So we're 11 weeks into this market event, and plan sponsors are continuing to adopt CARES Act provisions. And while participants have stayed the course, they are increasingly seeking guidance. 96% of participants have not changed their investments, which is, as you know, the right action to take. Nearly 99% of participants have retained their target date investments. So anybody who's using the QDIA that you likely use, the target date investment, 99%, no changes at all. Less than 2% of plan participants have taken a coronavirus-related distribution. So we love to see that. Now here's a big thing. The average call length coming into record keeping, so the T-Rows, the Voyas, the Fidelity, the Empower, the BPASs of the world, the average call length is 21% greater now than it was 2 months ago. The reason for that is the participants are seeking more complex guidance. I can tell you, as my team and I work from home, the calls that we're receiving from participants are not your regular vanilla conversations about asset allocation and diversification. They want to know financial planning. They want to understand what is a distribution from a tax standpoint. What should I do for a loan versus a distribution? Should I be looking at home equity? Should I be looking at taking distribution retirement accounts with penalties? My employer has not adopted any of the CARES provisions. So the conversations are increasing in complexity. As far as the coronavirus-related distribution, availability, and usage, for those of you that are on the call, if you're in the leisure and hospitality space or the retail space, that's where most of the activity in terms of distribution, straight distribution, loans is coming from. But the silver lining there is still relatively low. Leisure and hospitality, 2.1% usage. Retail, 3.6%. So not overwhelming numbers, but numbers are increasing in the last few weeks. We are seeing an upward trend in distribution. So you'll want to be aware, and possibly you'll see that trend coming through. Again, trickling back to education usage. Traffic to educational content through our record-keeping partners has spiked since the week of March 29th following the passage of the CARES Act. So overall, visits have more than doubled. Where are they going? As I mentioned specifically, participants are going to decision-making tools. One of our partners has noted that participants helps them understand the potential long-term impact of taking it. So again, be on the lookout as plan sponsors for those requests from your participants. Any questions relating to CARES Act, distributions, loan provisions, we're here to help, whether you're a client or not. Don't hesitate. So the other side of our business is individual wealth management. We work with a large number of retail investors. And I just want to shift gears for a second and share with you a letter that we sent to our clients last week. I'm getting the question, why is the market doing so well and the economy is so bad? What's with this disconnect? So we drafted this letter and sent it to our clients, and I thought this would be a good opportunity to kind of share these thoughts with you in case you're wondering the same thing. So investors like labels for the economy and markets, and many of them with the word great. Great Depression, the Great Recession, the Great Lockdown. Well, we've moved into what we might call the Great Disconnect. How can stocks have rebounded so strongly in the last month amid so much suffering and economic damage? What's Wall Street seeing that so many on Main Street are not? For one, in the United States, more than 20 states have already begun to reopen their economies, and others plan to begin to do so very soon. Europe, lockdowns are being eased following Asia's lead. Even gradual progress like this may help the stock market focus more on what's ahead than where we are right now. As lockdown restrictions are lifted, timely indicators like vehicle traffic, electricity consumption, public transportation use, daily consumer confidence surveys, and a wide variety of economic indicators point to a low market in the economic activity in the United States. The Great Lockdown Recession of 2020 may be over already, although it may not be officially declared a recession for several more months. Nowhere to go but up isn't normally very reassuring, but to the stock market it may be. Historically, when things have looked their worst, the opportunity in stocks has tended to be best. The S&P 500 index has usually hit its bottom and started to climb back up about 5 months before a recession has ended. Again, 5 months before a recession has ended. S&P 500. Other factors that have helped boost investor sentiment recently, market participants have gained confidence from the bold stimulus response from policymakers and the Federal Reserve. The total amount of the stimulus this year is about 22% of the entire U.S. economy based on GDP. During the entire 2008-2009 financial crisis, the total amount of stimulus was just 6.6%. There may be more. Surging unemployment and weakening finances at the state and municipal levels may be a catalyst for more action. Millions of jobs have been lost to this crisis. Many millions surely have been saved as well. The medical community also has provided reasons for optimism. Though no one knows for sure when a COVID-19 vaccine will be ready, rapid progress is being made. Several promising candidates are now in human trials. Testing capacity is also ramped up, while some of the best capitalized companies in the world are developing contact tracing tools to help facilitate. While stocks may have come a bit too far, too fast in the short term, markets are clearly responding to positive development. Reopening the U.S. economy will be a gradual process. Temporary setbacks may be possible. Some of the lost jobs may not return. The possibility of disappointment as the great reopen unfolds is real. We're facing a tremendous challenge, but it is not being met, or it is being met, with incredible resilience, resourcefulness, and innovation. Together we'll get through this crisis and return to better times. So that was a letter again that we sent to our clients last week. I thought I'd share, maybe to make everybody feel a little bit better about where the stock market is today, essentially where it's going. So I'll leave you with this. For any answers to any questions at all, please contact my team and I. Our email is generic. This is support@onegroupra.com. Also, if you're interested in this type of content, host a bi-weekly call on the markets. Our next call is Thursday. Next Thursday being hosted by Vanguard. So again, send us an email to support@onegroupra. If you want us to kick you over on that call. Allison, with that,
Thank you, Joe. And Joe, we did receive a little bit of feedback that it was difficult to hear some of your comments. So we apologize about that. I will tell you that we have taped this entire webinar, and we have a transcript of every webinar on our website. So I know that some of the things that Joe mentioned about upcoming events and different information was certainly helpful. It will all be on our website, as well as Joe's email address if you need to contact him with anything that you might want to ask him about. So we apologize about that, but I think that if there was something you needed to get from that you couldn't quite hear, it will be on the taped version or the transcript. Now we're going to turn things over to Todd Hoffman. Todd is with us this afternoon. He's been helping guide our clients, many of them on small business relief and specifically the Paycheck Protection Program. And Todd will be sharing some updates with us today. Todd?
Thanks, Allison. I'm going to be brief today, so we'll get everybody out of here early for once. There seem to be quite a few questions circulating around about how loan proceeds from the PPP program can be spent and how that ties into calculating the loan forgiveness piece of it. I'm going to stop here and just reiterate our statement that I'm not an attorney or a CPA, and you should definitely speak directly to a CPA or attorney because you're going to want to utilize their knowledge, their expertise to walk you through the process of calculating the loan forgiveness, because it is not as straightforward as I think many people thought it was going to be. The more I learned about it, the more that really sticks out. So one example is that many people are missing that the inherent in the there is an inherent imbalance built into the PPP loan calculations. So in other words, the maximum loan amount is equal to 2.5 times the average total monthly payroll cost during the year prior to the loan. So that equates to a little over 11 weeks of payroll cost. The period that you actually have to spend the money is only 8 weeks. So if you're dividing 8 by 11, that gives you just under 73%. So that factor alone makes it difficult to spend 75% of your loan proceeds on payroll during that 8 weeks. That's a question that's been raised and we have not gotten. I have not heard back that there's any definitive feedback from the SBA about that, because you're basically supposed to spend 75%. God, having trouble talking today. You're supposed to spend 75% of your money, but you have that many weeks less to actually spend it. So it's, as I said, inherent in the program. Additionally, the forgiveness calculation for the loan forgiveness is based on a combination of 2 calculations. It's the number of full-time equivalent employees and your payroll costs themselves. So when you end up merging those 2 equations together, it complicates the calculation that's actually eligible for forgiveness, the amount that's eligible for forgiveness. So again, talk to your CPA, talk to your bank. It's really important you do this because you might be making assumptions that are not actually true. Everybody's been waiting for an update from the SBA. One did come out yesterday. It deals primarily with the safe harbor provision of the PPP Act relative to certification of the required good faith certification, which is specifically directed at the necessity of the PP funds for your business. And I guess I want to just point out that I sat in on a seminar, and the whole seminar was about how the government is going to audit for fraud or misuse, and that you need to be tracking how your money is being used very carefully. Have a spreadsheet, keep the funds segregated, be able to back it up, everything you're doing with something with the paper that shows what you did. I think that it's likely that if you have a smaller loan amount, think under $2 million, you're much less likely to get audited or if that to happen. But again, be aware that they are looking at that and they've made statements about it. If you want more information and see specifically the updates that came out, go to sba.gov and look under the frequently asked questions section. And that will get you up to date as to the most recent changes. That's all I'm going to bother you with today. If you've got more questions, again, reach out to us and we'd be happy to help you out or point you in the right direction. I'll kick it back to Allison.
Thank you, Todd. And it's never a bother hearing your updates. So thank you so much. We do want to thank all of you for participating in our update series today. We will continue to post information to our website. It's onegroup.com. We will be posting everything referenced in our discussion today, transcript, tools, etc. And we certainly encourage you, as you heard everyone say today, to reach out to your one group contact with any clarification you need, any additional questions you have. We continue to be here for you during this challenging time. We look forward to helping you, your business, and our communities in the future. Thank you. Have a great day.